So she is 66 years of age. She had implants from 1991, silicone implants what are above. So she had a workup done, which was an MRI. And as you will see, if you come here and look, these are subglandular, that is above the muscle. Both intra, that is within the capsule, and extracapsular implant ruptured bilaterally. And so that means that the silicone has left the capsule and is outside. Extracapsular, intra mean within, so it's ruptured both within and outside extracapsular. So that was a test going into the case on someone with a lot of inflammation on her chest. So as you will see, this is the En Bloc, complete En Bloc 12825 DV. And so as you will see, a lot of inflamed tissue. Now look at this protrusion. This looks, look at this bulge. It's like a ball. And I'm dissecting and I see a lot of inflammation. This is unhealthy tissue. And look at this ball. And I'm going to dissect around it. And look at a lot of inflammation on the side. If I cut this, you will see it is bad tissue, inflamed, angry. All done En Bloc contained. So what I'm going to do is on the right side, En Bloc, the gold standard. Let me go in and dissect. Look, let's look at this ball. So you have to go in. Let's go in from here so you can see this consistency of this tissue. So you can see how hard it is, right? It's abnormally hard and it's very thick. You can see how hard it is. That's why I removed it. If I touch it, you can see it's not a healthy tissue. You don't want to leave that behind. So as I go in, I'm going to very carefully dissect around this because I want to show you what it is. Because having done a lot of these explants, there's the capsular tissue right here. And look at this protrusion right here. Alright, so I'm going to go in now. This is how we dissect bluntly, if you will, without the bovie. And now look at this. It's all contained. Look at this bulge. All contained. None of this spilled into the chest. And look at this tissue, transparent and thin here, but relatively very thick, as if this was a focal rupture. So if I cut through this, you will see this is unhealthy tissue. Look at the scar tissue, the white prominent. So it is important to remove the capsular, but it's important to remove all of this bad tissue around. So the inflamed tissue around. Just want to dissect to show this is unhealthy tissue, whatever I'm removing. All contained, done En Bloc, none of this spilled into the chest. And you can see the intensity of this bulge right here. If you cut into this, let's say, and I'm going to kind of reproduce this if you're rushing through the surgery. This is where you never know what you're going to find. It's like a trap. And every surgeon has to go in thinking, now for me, I had the advantage that this MRI was done. But, you know, looking at the MRI, you cannot predict where you're going to go. You have to always assume these bulges are there. So, take-home message number one, this tissue is bad. You can see, look at this tissue. It's not healthy. If I touch it, it's irregular, abnormal. It's nodular. And then you see this bulge, all contained, and none of this. If I send this tissue off separately, which I don't want to do, there will be possibly more incurring charge for the patient. You will see this is part of the inflamed tissue of the ruptured implant with an explosion, and then the tissue around is also bad. So imagine if you're dissecting, all done En Bloc, and you can see this is hard. If I go in, you will see, look at this ruptured implant. None of this spilled into the chest, all contained. And I'm going to actually go in from here. Look how thick this tissue, you can actually hear it being cut. And look at this implant itself. Look at the way this has disintegrated. This has literally leaked out. Everything contained, and none of this spilled into the chest. And you will see this is hard like a rock right here. All contained En Bloc. That's why someone was saying, why do you have to do an En Bloc? You have to always assume. Now, we have done implants. You know, I did an implant a week ago today, 775. That was ruptured from 2017. This happens to be from 1991. And you can see how hard this is, right? And with a lot of inflammation. This is like the scales of a fish, if you will. See how hard that is? All contained. This is another set of implant. The main kind that was used in the early 90s. And I'm going to go ahead and see what it says over here. But again, all En Bloc. I'm going to go ahead and remove our top glove. All inflamed tissue was removed. Look at this. Tissue is not healthy. Remember, there is like extra capsular, a lot of inflammation around. All of that was removed. And as I go in, look at this tissue that's weeping. Very hard. I'm going to go in actually from here. It's hard and calcified. So let me find another access point. Also very hard here. It's so hard that I was able to puncture it just by putting pressure on it. All done En Bloc, none of that's spilled into the chest. You can see it's not only the implant but the capsule, but the tissue around that has to go, because that's where the badness is. And if I invert this out, you will see. And look, some areas are so thin. You can see my glove, right? My green glove. So you don't want to puncture it, because what if there's some fluid inside? And as you will see right here, very hard, like scales of a fish. Alright, so there you have it. En Bloc, the gold standard. The implants will be returned to the patient. Capsule, send to pathology, rule out the BIAL, CL, CD30 analysis. Cultures for aerobic, anaerobic, and fungal. All bad tissue was removed. There's only good, healthy tissue remaining behind. And as you can imagine, the contracture that she had, how much and what freedom she's going to have from the inflammation. She was living with this possibly ruptured for years and decades. I do not know how long. It's been 34 years since she had these one set of implants, and they're certainly not lifetime devices. And one can only just look at this and understand as to why and what are the long-term consequences of having implants. So this is Dr. Khan, Executive Plastic Surgeon.